Welcome back, everybody, to the Deep Dive.
Yeah.
I'm Don, your radiologist.
And I'm Marge, orthopedic surgeon.
And we are knee geeks.
Absolutely knee geeks.
And so today we're talking about the evolution of knee imaging.
Ooh, exciting.
Yeah. So how did we used to look at knees?
Well, we used to just get like a snapshot in time, like with an x-ray.
Yeah.
And that's great if you want to see a fracture.
Sure.
But the knee is all about movement.
Right.
So an x-ray, it just doesn't cut it.
It's like looking at a photograph of a car
Exactly.
to figure out what's wrong with the
You
engine.
can't hear the engine.
Right. You don't know what's happening when it's moving.
It's like trying to understand a symphony by looking at just one note.
Yeah.
You're missing the whole story.
Exactly. And that's what's so cool about this deep dive
Yeah.
that we're doing, because we have a paper from the Knee Journal from 2023 describing this new device that allows us to do dynamic CT scanning.
Under weight-bearing conditions.
Yeah.
Now, that is a big deal.
Yeah. So tell us why.
Well, because when we move,
Yeah.
our knees are experiencing forces and loads.
Yeah.
And so the way the bones align, the muscles fire, even the space in the joint,
Wow.
it all changes.
Yeah.
So you need to see that in action.
Right. So this device is pretty awesome.
Uh-huh.
It lets patients simulate a squat while they're lying down.
While they're lying down.
So it mimics what happens when you're standing and doing a squat.
That is so cool.
And so what I thought was interesting about the study was that they validated it.
Yeah.
They looked at the horizontal squats and compared it to a standing squat.
Right.
And they looked at the knee movements, or what we call kinematics.
Right.
And they looked at muscle activation patterns.
Mm-hmm.
And what they found was that if you put about 42% body weight load
Oh, interesting.
on the patient during a horizontal squat,
Okay.
that most accurately reflects what happens when you're standing.
So 42% is the magic number.
Yeah. So that's pretty cool.
That's really cool.
So they actually were able to put this device onto a CT scanner.
And you're talking about a wide beam CT scan.
Yeah, wide beam CT scanner.
Okay.
And that allowed them to capture these real-time 3D images.
And low radiation dose.
Yeah.
Which is amazing because a lot of people get scared about that.
Oh, yeah. Radiation is always a big deal.
Yeah.
So not only are we getting more detailed information, but it's potentially safer as well.
Exactly. Win-win.
So they were able to then take all these images.
Right. Tons of images.
Tons of data.
Lots and lots of data.
And so they actually developed an automated image processing workflow.
Oh, wow.
To analyze the CT scans.
Okay.
And that eliminates the need for radiologists.
Oh, really?
To be sitting there with their protractor.
You're with the protractors trying to figure out.
Trying to measure all these tiny angles.
I'm getting headaches.
Exactly.
Right.
So really interesting.
So much easier now.
And they focused on 3 key measurements that tell us how the kneecap's moving.
Yeah, so the kneecap or patella.
That is riding in a groove on the femur.
Right.
And those measurements tell us, how well it's tracking.
Yeah.
And that's really important for diagnosing patellofemoral pain.
So the measurements are?
Tibial tuberosity, trochlear groove distance.
That's a mouthful.
Or TTTG.
TTG.
Bisect offset. Or BO.
EO.
And lateral patellar tilt.
LPT.
LPT. Perfect.
Yeah.
So they looked at patellofemoral pain syndrome.
Which is a really common cause of knee pain, especially in young active people.
Yeah.
Yeah.
So did they see any differences?
Yeah. So even with a limited sample size,
Yeah.
they saw some differences in the TTTG and the bisect offset between healthy knees and knees with patellofemoral pain.
So this really is cool technology.
It is.
It allows us to look at things that we've never been able to look at before.
We can start to see why people are having pain.
Yeah, and for all you knee enthusiasts out there listening, if you like what you hear,
hit that like button.
Hit that subscribe button.
And ring that bell.
Yeah, so that you can be notified every time we put out new content.
New knee content.
That's right, knee-tastic content.
Oh, yeah.
So stay tuned.
Yes. I mean, it's amazing to think how much information we were missing when we were just looking at a snapshot.
It's like we've gone from a still photograph to high-definition video.
Right, exactly.
And the implications for patient care are huge.
Huge.
I mean, we can use this information to develop more targeted treatments.
Yeah.
Better rehab.
Yeah.
And maybe even prevent some of these injuries from happening.
Absolutely. I mean, that's the ultimate goal, right?
Yeah, keep people moving.
Yeah, keep people doing the things they love.
So I'm curious, how specifically could this change the way we diagnose and treat knee problems?
Well, let's take the ACL, for example.
Yep.
A very common knee injury, especially in athletes.
Right.
So with this technology, we could see exactly how the ACL is moving, how it's functioning under different loads and movements.
So we could potentially diagnose ACL tears earlier and maybe even intervene before a complete tear happens.
Right, and we could even monitor the healing process after surgery.
Oh, that's cool.
Yeah.
So what about meniscus tears?
Meniscus tears, those are tricky.
Yeah, they are?
So the meniscus, it's this C-shaped piece of cartilage,
Yeah.
acts as a shock absorber in the knee.
Right.
And they're really common and sometimes hard to see on a regular MRI.
Yeah.
But with dynamic CT, we could actually see how the meniscus moves
Right.
under stress, and we get a much clearer picture.
So more precise diagnosis.
Yes.
Better treatment plans.
Better outcomes.
So it sounds like the possibilities are endless.
They really are. I mean,
Yeah.
think about osteoarthritis.
Oh, yeah.
Huge problem.
Huge.
Imagine being able to see those early changes in the cartilage
Yeah.
before there's significant damage.
So we could intervene earlier
Exactly.
and maybe even slow down the progression of the disease.
Right, because right now we don't have a cure.
There's no cure.
So if we could catch it early,
Blade joint replacement, that would be huge.
it's all about prevention.
Yeah.
Shifting our focus from reacting to these problems
Yeah.
to being proactive.
I like that.
Yeah.
It's like having a crystal ball for the knee.
Right. We can see into the future.
You can see into the future.
Yes, of course.
Now, let's be real. This is a new technology.
Right.
So what are some of the challenges?
Well, one of the challenges is access.
Okay.
These wide beam CT scanners aren't everywhere.
Yeah, and they're expensive.
They're expensive, but as technology advances...
Hopefully the cost will come down.
Right. And then there's some technical challenges too, like
Okay.
the image processing algorithms. Those are still being refined.
Yeah, like any new tool, it takes time.
Right.
It takes practice.
To master it.
Yeah. But I have no doubt that people are going to continue to work on this.
Oh, absolutely.
Make it better.
Yeah. And it's not just about the technology itself.
Right.
It's how we use it.
Right.
We need to use it responsibly.
Ethically.
Yeah, with the patient's best interests in mind.
Absolutely.
It's like having a powerful sports car.
Okay.
You got to know how to handle it before you take it out on the road.
I like that.
Yeah.
But let's bring it back to our listeners.
Yeah.
What's the one key takeaway you want everybody to remember?
I think the most important thing is that this technology allows us to personalize knee care.
Wow.
We're moving away from that one-size-fits-all approach.
Yeah.
We can see each individual's knee in action, understand their biomechanics.
So it's like a custom-made suit
Exactly.
for the knee.
It fits perfectly.
Addresses their individual needs.
And that's going to lead to better outcomes.
Yeah, I like that.
It also empowers patients.
Yeah, how so?
Well, they can see what's happening inside their own knee,
Uh,
understand their condition better,
yeah.
and participate in their own care.
So it's a win-win for everybody.
Absolutely. It's a more collaborative approach to knee care.
I love it.
Yeah. Working together as a team.
All right, so before we wrap things up,
Yeah.
I want to leave our listeners with a thought-provoking question. Okay, we've talked about how this technology can help us diagnose and treat knee problems.
Right.
But what about prevention?
Oh, that's a good question.
Could we use this technology to identify people who are at risk for injury?
That's what researchers are looking at right now?
Yeah.
I mean, imagine if we could screen athletes,
Yeah.
dancers, anyone who puts a lot of stress on their knees.
Or even just regular people.
Exactly.
Like kids.
Yeah.
So we could develop training programs,
Right.
interventions,
To strengthen those knees.
reduce their risk of injury.
Really warning system for the knee.
That's awesome.
I know.
So this really is a paradigm shift,
Absolutely.
the way we think about knee health.
It's exciting.
Yeah, moving from a reactive approach to a proactive approach.
Empowering people to take control of their knee health.
I love it.
Yeah.
So that brings us to the end of it, another deep dive.
Yeah.
Hopefully everybody found it informative and inspiring.
If you have any questions,
Yeah, leave them in the comments.
we love hearing from you.
All right, until next time.
Keep those knees healthy and happy.
And keep on moving.
Yeah,
Yeah, it really is a paradigm shift.
it is.
You know, it's like we've gone from the Model T to self-driving cars.
Right.
Like we've gone from basic mechanics to this sophisticated system.
That can predict and prevent problems.
Yeah.
That's a great analogy.
It really highlights the importance of staying ahead of the curve when it comes to knee health.
Absolutely. You can't just wait for problems to develop. You have to be proactive.
It's like investing in a good retirement plan for your knees.
I like that.
You start early, you make smart choices, and you reap the benefits later on.
And just like a retirement plan, There are multiple factors that contribute to a healthy outcome.
Right. It's not just about avoiding injury.
Right. It's about building strength.
Maintaining flexibility.
Listening to your body.
So this isn't just for athletes or people who've already had knee problems.
No, this is for everyone.
Even if you've never had a knee issue.
Exactly.
You need to know how to protect your knees.
We all rely on our knees for so much.
Yeah, walking, running, even just standing up from a chair.
Yeah, they're the foundation of our mobility.
And we need to treat them with care.
We do.
And that's where this technology is so exciting.
Yeah.
Because it gives us a deeper understanding of those foundational structures.
It allows us to personalize care, optimize outcomes, empower individuals.
It's like having a roadmap.
Yeah.
To guide us on our journey towards healthy knees.
And we're just starting to explore the possibilities.
It really is an exciting time to be in the field of knee care.
Absolutely.
We've come a long way from those static X-ray images.
Yeah.
And the future is looking bright.
It is.
So, Marge, any parting words of wisdom for our listeners?
Stay curious, stay informed, and stay active.
I like that.
Keep learning about your knees, ask questions, and don't be afraid to seek out expert advice when you need it.
And most importantly,
keep those knees moving.
All right, well, that brings us to the end of another deep dive into the world of dynamic knee imaging.
Hope you enjoyed it.
We hope you found it informative and inspiring.
Yeah, and if you did,
hit that notification bell
so you don't miss any future episodes.
Until next time.
Keep those knees healthy and happy.
And keep on moving.